get some 3 or 5 cards or some scratch paper that they can write questions on.
Okay.
And then about 10 minutes before we're done, if you have any questions, we're going to be recording this tonight, so I want, rather than not be able to hear your questions, just write them down and then we'll gather them and then we'll go through the questions at the end. Okay? All right, well, here we go. Let's talk about this. So, I met most of you. If I didn't shake your hand, I apologize, but I like to meet everyone who's here. Just by show of hands, raise your hand if you're the person who's most interested in neuropathy because you're experiencing symptoms. Just raise your hand. And raise your hand if you're going along with somebody who, or you know somebody who has neuropathy. And you're like just doing a little research for them. And that's great. I think we should all learn about neuropathy because if we live long enough, all of us will eventually have neuropathy if you haven't already had it already. Neuropathy is sort of like neurodegeneration. If you live to 85 or older, you're going to have some nerves that start to decay and have dysfunction. But what we're going to talk about today is what neuropathy is. I'll go to the basics, and then we'll talk about how to determine what's the cause of your neuropathy. The 4 basic types. And if you look in your little handout, you'll have a little worksheet so that it helps you pay attention and fill in the blanks. And if you don't get anything, at the very, very end, after I stop recording, I'll go through, or Jordan can go through and help you fill in your answers. But I have a key up here. Since I created it, I should be able to know what the answers are. But exactly. Neurodegeneration, right? When the synapses aren't firing. So we'll talk about, once again, what neuropathy is, what are the causes or the main types of neuropathy. We'll talk about what fibers are involved, meaning what nerve types are involved. We'll talk about the different nerve types and what the functions of those are. And by the time we're done with this class, you'll have an idea, hey, I think I'm sort of this type of neuropathy, if you are one of the persons, or if you know someone, I think they're this type of neuropathy. And the sad news is there's over 100 types of neuropathy. I've spent the last year in a master's program at the university in Dallas, and I basically learned that there's even more. There was one paper that we went through, 278 pages of all the different types of neuropathy. So it's quite a few. Does that sound good? Now, just so that the elephant's out of the room, I will have an offer at the end where if you feel like this is something that you're interested in doing and helping us figure out for you, I'll give you a chance to work with us more. If you don't, it's totally fine. This is a free workshop. You are totally welcome to just take the information and use it however you want. Hopefully, by the time we're done here, you guys have some motivation to at least change one thing that you already know. You already know you should change something to make yourself healthier, but hopefully you have motivation to change at least one thing. Okay? All right. So, if you didn't have a chance to read through that testimonial, we have lots of testimonials. If you're interested in looking at some of the different testimonials of patients who've had great results in our office, go to my Google reviews, and we have dozens and dozens and dozens. Just go through them. There's all different types of Google reviews. I'm not going to go through all this. Needless to say, I have a whole bunch of training in treating the brain and treating the peripheral nerves and how they communicate together. Let's just make it that simple. Lots and lots of training. This I did 2 years ago. I probably have over 1,200 hours in neurology at this point. I'm still learning. This is my family. Came from all of us are adopted, and we have several Koreans in our family. We have some mixed black and white, and then a full black, and then my sister and I were adopted together. All of us were adopted. But the cool thing about this is it just makes me realize that no matter what culture, no matter what background we come from, we all have nerves that help us figure it all out, help us experience. So let's talk about some of the statistics on peripheral neuropathy. Like I mentioned, over 100 different types. Each has a unique set of symptoms. I'll try not to, maybe I'm blocking you too much. Is this okay if I'm standing right here? This is all research that I found as I've been learning about it and learning to treat it, but about 40% of people on statin drugs get neuropathy at some point, usually within about 2 years. So if you've been taking any statin medications, then that might be something to think about. People who use statins more than 2 years have about anywhere between 4 to 14 times, that's 400% to 1,400% greater risk of getting a neuropathy. And the reason why is because of the buildup and how it affects your liver and how it affects the energy of your nerves. Your nerve cells actually produce energy so they can function.
What's a statin drug?
Statin drugs are the cholesterol lowering medications. So it's something like atorvastatin, simvastatin. They end in statins, most of them. There's also fibrates that are a sort of a swing around, the phenofibrates and some of those type of medications are also used to lower cholesterol. Now, some other sobering statistics, about 50 to 70% of diabetics in the US will have peripheral neuropathy. So if you are a diabetic, whether it's a type 1 or a type 2, you have a high likelihood. There's over 100 million people with pre-diabetes or diabetes in our country right now. Does anyone know how many people are even in our country? About 330 million, something like that. Maybe it's a little more now, but it's like a third of the people in this country are dealing with this blood sugar dysregulation problem. Lots of money spent every year, and it usually starts in the feet. About 70-80% start in the feet. So the nerves that go to the feet are the longest nerves. It takes the most energy to get the nutrition down to the tips of the nerves, and that's usually where the symptoms start, in the feet. So everyone always asks me this question. It's a big question. I'm just going to tell you right up front. Everyone asks me the biggest thing they want to know in their mind, even before they learn about neuropathy. So I decided to tell you this before so you can pay attention to what I'm about to teach you about neuropathy. Everyone wants to know, does Medicare cover this? And the simple answer is no. The longer answer is because when we bill $65 for an adjustment, they allow us to charge $38 and they'll pay us around $13. And so they cut it in half and cut it in half and cut it in half. And I've adjusted hundreds of patients with neuropathy before I started doing this up to from 1998 to 2008, and that's about when I started. I adjusted a whole bunch of people with neuropathy weekly, twice a week, and their neuropathy never got better. Their back pain got better, their neck pain got better, their headaches got better, but their neuropathy never did. And I was always confused because I thought, I was young then, I've been doing this 21 years, I thought if I just adjust the people in the right way, everything will be fine. Mind you, I'm not trying to cure cancer. I'm not trying to do those kind of things, but we basically found out that in order for us to get a result with neuropathy, we had to do things that weren't covered by Medicare. This is just for the adjustment portion. Now, when we do an adjustment on someone, that's what we charge, and that's what they pay. This is a screenshot out of our system from us posting a check from Medicare. So, like I said, if you just want to get adjusted, it's not going to fix your problem. You need to do other things, and that's what we'll be talking about towards the end of the lecture tonight. Does that make sense to everybody? Mm-hmm. All right, so here's another thing about Medicare. This is out of their website. This is from Medicare.gov. Medicare does not pay for maintenance care. Now, maintenance care is a very confusing term. Mm-hmm. Maintenance care includes services that seek to prevent disease, promote health, prolong and enhance the quality of life, or maintain or prevent deterioration of a chronic condition. That's what is called maintenance care. Guess what Medicare expressly does not cover? All that. So if you want to prevent disease or enhance the quality of your life, now, this is in a chiropractic office. There are some small exceptions in the medical, conventional medical model. You can go to your medical doctor and get a yearly wellness exam. But I don't know always if that's going to do what we just talked about. So, hope you guys understand. You guys ready to learn about what neuropathy is? What peripheral neuropathy is? I'm going to keep this in my hand just so I don't miss some of the questions. So let's talk about what peripheral neuropathy means. It's basically a disorder of peripheral nerves. Now, I like to keep it simple. Peripheral means something not in the center. Mm-hmm. Make sense? So there's nerves that are in the center, like in your brain and your spinal cord. Those are central, that's your central nervous system. We're talking about nerves outside of that area. Anything outside of it. Nerves to your bladder, they're autonomic. They're controlled not by your mind. Unless any of you know how to do the complex process of filtrating your blood and getting urine and making all that happen. Most of us don't know how to do that, but the nerves that tell that system to function, that's an autonomic nerve, and that's also part of this system. So the main symptoms that we see, burning, tingling, numbness, eventually we get some cramping, balance issues eventually start to happen. So let's look at question 1, just so you don't we don't get too far off track. So peripheral refers to outer perimeter. Basically, when we look at question 1, we're talking about the body. That's things like the head. Starts with an H. I can give you a little cue there if you want to fill that in. It's question 1. We're talking about nerves in the head, meaning the face, neck, just not in the spinal cord. So we got head, arms, trunk, and legs. Can you guys think of a condition that involves the trunk that sometimes elderly people get, that involves a virus that's very, very painful? Very good. That's in the trunk. It's in the middle of your body, but it's not in the spinal cord, so it's a peripheral nerve. Does that make sense? Good. So shingles is a peripheral neuropathy. What's the cause? A virus. Chickenpox virus. Okay? You guys with me? Head, arms, trunk, and legs. So, we're going to break it down. Neuropathy, look at question 2. Neuropathy can be broken down into neuro and pathy. So neuro refers to nerves. That's that first blank on question 2. And or nervous system dysfunction. Say pathy refers to disease or dysfunction. So once again, just to highlight it, we have our spinal cord and brain. What is that called? What part of the central nervous system? You took the words right out of my mouth. And then the nerves in the head, the ones that aren't in the brain, the ones in the head, the arms, the trunk, and the legs are peripheral. It's too easy, right? But peripheral neuropathy can be very confusing when you're going through it, because you seek help and you can't get help. The solutions that they offer you are very, we'll just say, one-sided. They don't seem to cover the scope of what can happen. So if you look at this tree, we've got roots, and that brings the nerves up into the trunk, and then you have leaves that grow. So what would be a sign that the tree is not getting enough water?
Yellow leaves.
Yeah, the yellow leaves. It's not like the tree just, they don't have enough water, boom, falls over. Same thing with our, we have signs and symptoms in our body that tell us that the nerves are not getting enough fuel, and we'll talk about those in a second. So here's just a little expanded blow-up of a peripheral nerve. See how there's multiple cable wires in there? And then there's bundles and fascicles. So it's all packed in there, just like a telephone wire. There's multiple different lines that go into this building, and they go to different offices. Same thing with our nerves. So you see how there's a bundle? So we sort of unpack this a little bit. What are these things over here?
Blood vessels.
Blood vessels, exactly. So the blood vessels supply the nerves just like they supply everything else in our body. Every cell in our body needs oxygen, needs glucose, and you need blood flow. All right, so now I'm going to give you a little quiz. We have 2 main types of nerve fibers. I'm going to say, let's see, so do we get number 2? All right, we're not quite to 3 yet, but I got to teach you something. When we talk about the types of nerve fibers, we basically have large and small. Do you notice how I made these in bold? They're thicker, they're bigger, and these are small. So what I'd like you to think about is which tend to be faster, the small fibers or the large fibers? Which do you think? Raise your hand if you think the large fibers are faster. Okay, raise your hand if you think the small fibers are faster. Raise your hand if you don't dare to answer because you don't want to be embarrassed. All right, so the very brave 1 or 2 of you who thought the large fibers were faster were right. Think about it. We don't want to give him a big head because he got the right answer.
Yeah.
But if you think about it, which roads do you travel on faster? The bigger highways or the smaller surface streets right around this neighborhood? You're going to go on the bigger streets. There's more lanes. There's more space, so you can go faster safely. So the things that are, the functions that are created by these large fibers that are the sensations that are transmitted. Remember, we're talking about sensory nerves right now. Can anyone think of what the other type of nerves are besides sensation? Go like this. Scratch your head because you can't think of it. Yep. So for you to do that and to move, it's called a motor response. So your brain had to tell your arm to move, and so you had a signal that came from the brain out. Most of the sensory nerves that we're talking about are going the other direction. Just like I-15, we have north and southbound traffic. It's still one highway, but they're sort of different lanes, right? We try to keep them separate. So all the large fibers have balance, vibration, pressure, light touch. Very fast signals. Do you think it's important to know where your body is in space every time you take a step? That's balance. What would happen if you couldn't do it? You're going down. Exactly. So small fibers will send different types of sensations. Temperature, some sharp and dull pain, and then itch sensation comes from. These are all things that neuropathy patients tell me they have. Small fibers. So can you see how the history part, when we give you and there's a little subjective questionnaire on this packet, as you go through those symptoms, I'm looking at them. I'm not just asking you just for fun. I want to know what the cause of the problem is so that I can figure out how to fix it and help you fix it. Does that make sense? All right, let's talk about the 4 different types of peripheral neuropathy. I want you guys to work with me on this. I'm trying to make this as colorful and as exciting so that you don't forget. So there's 2 lines of 4. So in the top line you'll write hot, cold, sweet, and toxic.
Okay.
Can you guys remember that? Hot and cold, those are like opposites of each other. And then sweet and toxic. Those are the 4 main types. I can put hundreds of types. We can just put them all into those main 4 types. Okay, so let's talk about the hot. It's mainly known as inflammatory. And if you've ever got an infection or been bit by a rattlesnake or got an infection, anyone ever had gout before? You get really red joints, inflamed joints. If you've had rheumatoid arthritis, you know that there's a lot of inflammation there. Gout, autoimmune disease, infections, like shingles is extremely inflamed, right? So all these different causes basically can go into the hot. Okay, so underneath the hot, you want to write the sort of medical term for it, which is inflammatory. Does that make sense? Mm-hmm. Hot, inflammatory. Should be easy. So let's go to the next type. Has anyone ever seen any nails like this? Mm-hmm. No one has to show me right now. We'll look at them later. But this is so that's the cold. It's the medical term for cold is lack of blood flow, and that's atrophic. Lack of growth factors getting to that tissue. Does that make sense? So in medical terminology, in Greek or Latin, I don't know which, but troph means to grow. A means lack of, so you have lack of this essential nutrients needed to grow the tissue of the nerve. People who have really, really cold hands and feet all the time, hormone issues, thyroid issues, people with brain injuries. I mean, these are the type of, we see people with carbon monoxide poisoning. There's lots of different ways you can get this. But this is, once again, the cold atrophic type. So what happens when there's a decreased blood flow to nerves? You can't make the thing that you need to make. You can't make proteins. Does anyone know what this little cinnamon roll looking wrap around thing is called? What is it made of? It's made of fat. The medical term for that is, the wrapping is called myelin. Okay, that's not one of your questions, but when you lose blood flow and you lose you can't deliver the appropriate fats and you can't build the proteins, you don't wrap the nerve, and then the conduction slows down. When the brain is used to getting the feedback from that nerve and it can't get it, you have symptoms. Some of the symptoms we get from neuropathy come from our brain, and some of them come from actually irritation or degeneration or inflammation in our feet. Once the blood vessels get compromised and they start to decay, then the nerves start to shrivel. So if you don't have blood flow, you cannot maintain nerve health. So can you think of any situation that a normal person could have a temporary neuropathy on a daily basis potentially?
Sit on your feet.
sit on your feet, so you sit on chairs weird and do that. Some people sit on the toilet too long, and you'll start to get some neuropathy sensations. You'll lose the blood flow. Now, if you look, which do you think is more resistant to compression? I don't have an example to give you, but just think about it. If you have a wire with a whole bunch of wires in it, and you have a little tube, a fluid-filled tube, which do you think will tend to be easier compromised? The tube, the fluid, because the fluids sort of move around. This is made out of fat and protein, whereas we've got tiny little bits of fluid in these cells. So if there's compression, the first thing that happens is you lose blood flow to the nerve. And then you start a degenerative process. If you don't regain that blood flow, then soon you start having.
Is the top one a healthy?
Yeah, this is a healthy one. This is starting to have disease, and then this is no blood vessels. It's just starting to decay.
Okay, thanks.
So I just found a really nice looking picture. Doesn't that look delightful? Willy Wonka, Chocolate Factory. I mean, just visions of all this joy from all this sweet stuff. But basically, there's a specific type of neuropathy that I personally have coined sweet peripheral neuropathy, which is a side effect of chronic blood sugar dysregulation, meaning you can't maintain your blood sugar. It could be too high, it could be too low, but with diabetes, it's usually too high. Now think about this with me for 1 second. If you have blood sugar, if you have sugar at high levels in the bloodstream, where is the sugar not getting to? The cell, the muscles, everything that needs it, the nerves. Now, what about if you have low blood sugar? What is getting starved with low blood sugar? The brain, the cells, the muscles, all the things we just said. So high blood sugar and low blood sugar are not good to have. We don't want either one of them. We want it right in the middle, about 85 to 99. So there's all types of variants, but there's a specific thing that most people don't know is that when you have to, even if you're a type 1 diabetic and you have to take shots of insulin on and on, every day, multiple times a day, the brain and the nerves actually don't need insulin to absorb the blood sugar they need. So insulin is actually toxic too high levels of insulin is actually toxic to our brain and toxic to our nerves. Did you guys know that?
Other question. So I've often heard of high blood sugar or low blood sugar. Are there conditions where someone's prone to flip violently from high to low to high to low to high to low?
Diabetes.
Diabetes is that shock.
Yeah, because you
It's
eat
either
it,
low or
and then
high.
so the question was, just to repeat it for the camera, he's heard that people sometimes are prone to flip from high to low to high to low, and the problem is diabetes and pre-diabetes because the blood sugar is not getting absorbed into the bloodstream because the receptors at the cell are resistant to insulin because the body is making so much insulin that the cells are like, well, we got too much. We're going to resist it. And so then you have to make even more because if you have that blood sugar in the bloodstream, it oxidizes, and when that oxidation happens, that's when you actually have blood vessel damage. And what tissues do you think get affected when you have chronic blood vessel damage? The really important ones, like the retina and the eye. Extremely important. So if you don't care about your eyesight and your kidneys and being able to keep your toes and your ankles, my aunt, she had her leg amputated at the knee shortly before she passed away. We've heard of Larry H. Miller. He had the same thing happen. He ended up dying from widespread body infection because of this chronic dysregulation of blood sugar. So it's very serious. Like I said, 100 million people in the United States have this, either diabetes or pre-diabetes. And obesity is just rampant, even in the young kids now. So retina, kidney, and toes, pretty important. If you like to keep those, keep your blood sugar under control. So if you don't, you'll end up having things like ulcers. And when you have ulcers, once again, you need to have blood flow to those tissues. But I've seen a diabetic patient, this is a type 1 diabetic in my office, she pulls off her shoe and sock and shows me her little bone wiggling out of her toe. Eventually she was able to get some oxygen therapy and hyperbarics and able to get it healed. But yeah, this is progressive. When you lose blood flow, you cannot function. So the fourth type we're on is toxin, is called toxic. And the other name for toxic is toxic. So I couldn't think of another name for it. But just to be very simplified, medications can do it, tobacco can do it, alcohol can do it, plastics can do it, heavy metals can do it, pollution can do it. I mean, there's so much that we can't avoid in this world. But one thing we can avoid is what we eat. And I would highly recommend, if you have neuropathy or you want to avoid it, then you avoid as many of these as you can, and specifically artificial sweeteners. Can you think of anything that people drink a lot more, even more than water in this world, that has a lot of soda, and what specifically? Diet sodas. Diet sodas. I mean, if you really want to confuse your liver and dramatically exacerbate your ability to control your blood sugars, then just eat a lot of these.
Is sugar as bad as those then? Or just equal?
No, this is worse. This is way worse.
So that's diet. So
Diet
it's better to drink
drinks.
a diet. I mean a regular pop.
If you force me to say one is better, then yes.
Drink water.
Drink water I prefer, but yes, it's better to drink the other. All right, so can you remember the four types of neuropathy? The four general categories. Remember, these are you're not going to find these in the medical textbook. Say it again.
Hot, cold, sweet.
Everyone together.
Hot, cold, sweet,
toxic.
toxic.
And you can hopefully remember what that means. All right. Okay, so now go into question 4. Let me review this. There are 2 basic fiber types involved with neuropathy. Can you remember what the 2 basic types are?
Small and large.
Man, you guys are just better. You guys are better than some of the other groups I teach. You can understand this. Okay. So, we don't offer testing. We don't do EMG testing or nerve conduction testing for the large fiber neuropathy. The testing we do is not painless. Well, if perceiving cold is painful to you, then it's slightly painful, because we do touch some cold on your toes and see if you can feel it. All right, so what is the, let's go to, so we're just finishing number 5. So let's look at number 5, just to review and make sure I don't miss any of these questions. So what are the fibers that have to do with muscle weakness and loss of balance? Large. So you would write large fibers in number 5. And then underneath the second part of number 5, there's neuropathies also lead to other symptoms like burning, numbness, tingling. What would be the nerves fibers that are affected in that situation? Small. Now what if you have muscle weakness and burning, numbness, tingling?
All of the above.
I guess you could have some large and small fibers. Now, which tend to be affected first? This is what I haven't talked about yet
Small.
in neuropathy. Why? Why would you think that? I'm not agreeing with you yet, but why do you think small would be affected first?
They're more peripheral and subject to not get as much
Less
blood flow.
blood vessel flows.
So let's think about it a different way. So I don't like to tell you guys you're wrong, but let's think about it in a different way. And the way we think about it is the large fibers have a higher demand, and so when you pull the blood flow away, they'll start to have the symptom first. So those are so think about it. If anyone's ever had dizziness before, you know that it can affect you severely. But some people don't know they have bad balance until they do a balance test. And so a lot of people are like, whoa, I didn't even realize my balance was so bad. So it can happen very insidiously. Exactly, you got to put your pants on and you fall down, you're like, nope, I got to sit down from now on. I see the older gentlemen at the rec center when I go to exercise, and they're always sitting down to put them on. I like to just practice my balance and do it that way if I can. All right, is that making sense? So here's what we do. Number 6. In order to discover the cause of our pain, burning, numbness, tingling, cramping, or imbalance, we evaluate the sensory component, starts with an S, and the motor component. So they're actually related. I mean, they're actually in the same highway going from our feet to our brain, but we have to look at both because they're going northbound and southbound. Sometimes you can have a northbound accident that doesn't affect southbound traffic, but sometimes you can affect both in the same dysfunction. All right, so let's talk about, real briefly, we're doing good so far. Balance disorders is something that can occur from having neuropathy. Do you guys see why? Large fibers are affected. Your balance isn't going to be, it's either going to be almost absent or severely slowed. Infections and toxins, inflammation, lack of blood flow, all these things slow the speed of the fibers. So how fast do those fibers go in the large fibers? Like 120 meters per second. It's really fast. How fast do the small fibers go? About 60, 70 meters per second. Still pretty fast, but it's not as fast as 120. So we talked about this already. A lot of the people will tell me they have these weird phantom sensations. And the phantom sensations are things like, I feel like the sock is wadded up under my foot, under my toe, or I feel like I have a string wrapped around one of my toes. Check it, there's no hair there. I feel like I have just a pebble in my shoe, and I clean them out, and there's no pebble in there, but I feel it. So there's things happening that aren't real. That's called phantom. Your brain's perceiving a sensation that's not real. We had treated one patient recently who had a massive bone tumor. He had to have his leg amputated from the knee down, and within almost immediately from him waking up, because he had a lot of pain before, his brain was constantly interpreting that signal. He had cancer for almost 9 months before they finally said, we just can't save it, we've got to get it out. And he had started having phantom burning immediately. It's like his foot that didn't exist anymore, that was cut off, was under a blowtorch. He could almost feel that blowtorch burning his foot, and he doesn't have a foot anymore. So that's even tougher. Now there's tons and tons of research on how to help change that, and we've treated several of those cases successfully. I went through all the research from the past 20 years since an Indian medical doctor named Ramachandran invented this therapy called Mirabox therapy, and we've actually used it in many cases with several different types of limb pain, arm pain, and it actually helps. So that's something cool, but we can talk about that later. Those are common symptoms. So one thing you should remember, the problem is in the feet, for instance, but the problem is interpreted in the brain. And the sad thing that happens when you start not feeling your toe or your finger or a body part for a long time, it almost becomes non-existent to your brain. And some people don't care about it. Like they actually don't care about their neuropathy. In fact, some people, I had one patient who told me, I said, she had a fall in a doctor's office, not in my office, but and had a concussion and hurt her neck. So we treated her concussion and her neck pain, and I said, we've got to get this neuropathy fixed. She had severe neuropathy. She goes, but it's been so nice. I'm like, what do you mean? You fell and hit your head. You're having all this pain. She goes, well, it's been so nice not having the pain in my feet. Because she had went up the hill of pain, and now she had almost no sensation at all. And she was like, you're not going to make me start to hurt again, are you? I said, well, as we bring these nerves back, you will have a little pain as we go along, but then we'll be able to help so you don't have this other problem. All right, so I'm not the type of doctor that likes to criticize other approaches. I mean, you wouldn't be here if whatever approach you were already proposed was working for you. You wouldn't even care to look and see an ad that said there's some breakthrough treatment if you already were happy with the results. But the pretty much, I mean, the Mayo Clinic is saying we're trying to correct the cause, but the approach they use doesn't really correct the cause. So what they're using is pain relievers, which can cause addiction for one, constipation for two, and make you feel like not yourself and all sedated all the time. That's one option. You can also take some anti-seizure medication, or anti-epileptics as they call it. Anyone ever heard of gabapentin?
Yeah.
Lyrica? What do you think they're doing? They're just decreasing your brain function so you don't have a seizure. Wait, you weren't having seizures. You were having nerve pain. But we're going to give you a seizure medication that they use off-label because it actually works, because it decreases brain function to the point where you don't feel your nerves that you already couldn't feel, and that's why you're having the problem. It does not fix the problem, I guarantee it. it causes, and you think about the age category, I mean, most of you guys are over 50 in this room, or at least over 25 for sure. Most of you are over 50, but have you ever taken care of anyone with memory loss? Anyone had a family member that's gone through any of those kind of things? Guess what these drive? They're decreasing your brain function, accelerating memory loss. Just take one and tell me if you don't feel that. I mean, I'm not just making this up. This is what people tell me every day. You can also put some numbing agent on them to just numb the nerves even more, but your brain is very persistent. It'll help you create pain even despite the numbing agent going on there. But then if that doesn't work, they can say, well, now you can't sleep at night because you got this pain. Let's just give you some antidepressants. Because you're depressed now, because you're hurting, we'll work on treating this other problem. Okay? They don't really address the cause. So we have to, if we want to put out this fire that's going on and help the inert, we have to do more than just suppress the brain function that's involved. So there's some hope. We can figure it out. Here's how we do it. 3 factors. This is the example. So now we're looking at how do we solve the problem. You guys with me? What's the underlying cause of neuropathy? How much nerve damage has been sustained, meaning you've had some dysfunction to some point. Let's find out how bad it is. No one really wants to know. They know they're bad, but they don't always want to know where they score on the 0 to 100% or 100 to 0 percentile. But we need to know that because that tells us how much treatment your condition requires. Hello there. Welcome. So, we're talking about what we need to do to figure out how much treatment someone needs based on their exam. You guys with me? So there's several things that make us different. Our office, we look at the metabolic factors and we look at the neurologic factors. We don't just, like I feel bad sharing the story, but I'm just going to do it anyway. So I had this patient that was really dizzy, and they went and they did all this diagnostics, spent several $1,000s, and then they told her that you're having some dizziness. And I said, that's
After she
it?
spent all that money?
But she went to them because she already knew she was having dizziness. And so it's very frustrating. Like, well, what can you do for me? Well, we already ruled out this, and this, and this. Just, take this medication and you should be fine. Like, wait, I have to take this the rest of my life? Well, sometimes it's 1 month, sometimes it's 3. It may be up to a year or more. I've had patients come in taking 25 years of this certain medication. And you can't rehab your brain when you're on these type of medications for dizziness. So we look at, and basically I thought she was going to say they told her to just buy a helmet because she's going to be falling. She'd already fallen several times. So I don't like that approach. I'm like, okay, we can figure out what's wrong, but let's find out what are the contributing causes. And in many of these cases, we look at the neurologic factors, but we also have to look at the brain. We have to look at the gut function, because your gut is how you absorb all your nutrients. And then we have to look at how well your body is delivering the fuel to your tissues. That's what I mean by metabolic factors. You guys following me? Metabolic means delivering fuel to tissues. What we're going to be talking about on question 8, one of the ways we can look at structural component of it is we just take an x-ray. We can look at that, but what I'm going to be recommending, most of you have had an x-ray, some of you had an MRI, you still don't know why you're having this neuropathy. And a lot of times you haven't even had an x-ray to show if there's some compression that's contributing to your problem. But we have to look at a couple different things. We have to look at what's functionally wrong and what's pathologically wrong. Like some people have a genetic component. They have genetic neuropathies. All we can do is just hopefully manage them. We can never cure them. But when we look at lab panels, we do different lab panels. Sometimes people have an infection in their gut that's causing the inflammation that causes them to have neuropathy. Do you think I'm making that up? No, it's happened so many times that I'm shocked. People with severe pinworms, parasites, all sorts of C. diff and other things in their gut, and everything else is fine except for that, and we fix that or help them get the care they need for that infection, and their neuropathy improves. That's cool. To me, that's cool. That's like truly like medicine that's functional, that helps people. So we have to find out where the ranges are. A lot of people don't even pay attention. We'll talk to medical doctors who are used to dealing with a lot of very sick people. I'm not faulting them for their approach. I just want to compare you to the healthy subset of patients, rather than wait till you're fully diabetic and make a change. Let's fix some of the problems while they're not severe. So an example would be if this normal healthy blood sugar was 85, and now here it's at 95, here it's 100, well, we'll say 100 here, and then it's 126, and now here and out is diabetic. But what if you're here, you're like, oh, I'm just pre-diabetic, no big deal. Well, you're going to have blood sugar dysregulation. Your nerves are at risk. You're 4 to 14 times more likely to have these issues. So we look at comparing you to the healthy subset and say, let's work you towards that, even if it's not a number primary factor, like it's not blood sugar. It might be magnesium. It might be CBC, your blood, your red blood cells or something. So we got to look at those things on blood work. And most all of you have blood work almost every year, so we can get a lot of those information from blood work you've already done. Now, occasionally, we find, more and more lately, the last 5 years, we find that people who are sensitive to some of these things, gluten, soy, milk, eggs sometimes, yeast, and corn's a big one I'm seeing lately. But if you're sensitive to certain foods, and those foods are causing your immune system to react, you will have a much higher likelihood of having your own immune system attack your own nerves. That's autoimmune. Has anyone ever heard of that before? Is that blowing your minds right now? Or is this sort of just reminding you of things you already know? We've got to look at those things specifically in order to rule out. So then I like to, I'm very into numbers, and I don't know if you know from me, I'm sort of analytical. I like to figure things out. I like to solve Rubik's Cubes puzzles and do those kind of things. But I like to find out where your dysfunction is, and this is a balance test we did on someone. And she didn't have very good limits of stability at all. You're supposed to be able to lean forward and bring your balance into that box and all these different boxes. Everything's delayed. Do you think if she accidentally stepped on a little carpet that wasn't perfect and started to fall, do you think she's going to be able to catch herself in time? No, her reaction time is so slow that she's going to fall and hurt herself. So one of the things that I do with neuropathy is not just treat the neuropathy and treat the symptoms, but we're trying to prevent brain injuries, prevent hip fractures. Like, if you think it's not serious, if you've been diagnosed with neuropathy for more than 5 years, you start to not be able to feel the gas pedal. And if someone's a doctor with a really good doctor who finds someone with 5% function, you might not should be driving. So there's like mobility. Let me ask you a question. I always like to ask this question every time I teach this class. You only have 2 options. Everyone has to raise their hand. You don't get to not raise. Anyone have any fears in their life? So we're just going to talk about 2 fears. 1, are you more afraid of which? 1 or 2? Are you more afraid of dying? 1. Or are you more afraid of losing your independence and becoming a burden on your family in your older years? So who's more afraid of dying? Raise your hand. Who's more afraid of in their older years losing their independence and becoming a burden on their family? My point, every single time, same. No one wants to live and be a burden to their family and not be able to take care of their own personal hygiene and the needs that you need to do. Now, at some point, it's going to happen to all of us. We just lose our ability to do some of those things. But we want to stay functional as long as we can. Guess what will shorten your ability to be independent and functional? Neuropathy. One more quick story. I'm sorry, I have to tell you this. I had this gal we're treating just a couple weeks ago, right before Christmas. And we've been treating her. She had a brain surgery, and she lost one side of the function of her leg and her arm. But she was doing pretty good. So we were treating her. We're helping, almost like doing stroke rehab on her, even though it was from a brain tumor. And she's doing good. The doctor said, don't waste your time going to that doctor. But we were exercising her, getting her. She used to play tennis and everything. So we're getting her to be able to hold on to the tennis racket and the ping pong paddle, and she's having a little fun. And then one day she comes in and she'd taken a turn, and she's now dragging her foot. And she didn't have a walker. She was just with her daughter, who was referred her in. I said, don't. She's like, she needs a walker. Like, she just took a downturn. She needs to be on a walker. She can't walk around. That was a Thursday. The very next Monday, guess who I see in the office with a big black eye, split open head, black eye, face bruised, the same person that I just said. And now she had a brain injury on top of a brain surgery. And at that point, it was going downhill. Now, she's still doing okay, but she's not going to make it much longer. And you can't have a brain injury on top of these things and expect to be functioning better. So we can see that, and basically we have simple goals. We want to improve the blood flow. We want to stimulate small fibers to grow. We want to decrease your pain, especially if it's coming from the brain. And then we want to improve your balance. This is what we do in our neuropathy programs. Improve blood flow, we do that with several different things. We use lasers, we use thermal contrast, we use nitric oxide. Have you ever heard of arginine? Arginine is a big, it's an amino acid supplement that you can use that dilates blood vessels and helps stimulate blood flow. And then vibration is powerful. And then one highly overlooked thing called nutrition. What you eat determines whether your insulin goes up and down, determines whether or not your gut is inflamed and whether your tissues are inflamed. So if I had to be very, very frank with all of you, say just try this for 8 weeks. Don't eat any grains. Don't eat any milk products. No grains. That includes rice, quinoa, couscous, bread, pasta. Did I mention rice? Yes. Corn. Don't eat any of those things for the next 8 weeks. 1, you'll feel amazing. 2, you'll crave it a little bit, but you'll get over it in a few days. And then your inflammation will start to go down. I don't have to, I already told you not to drink any of the diet sodas, but then we work on specific things. We find out which side is your worst balance side. We work on that and you start putting balance into your brain. If we can do those things, you're willing to make a change, you will get better. Now, will it cure you? I have no idea. But we get a lot of people who have only 5% or 15% function who get up to 50 and 70 and 85% function. I haven't got anyone. Well, I've got a few 100%, but those are the ones that are more mild. Okay, so you guys with me? You're following? So we talked about we need to improve blood flow, but it involves decreasing your inflammation. We use some health lights, we use some other lasers that are high-tech, and we basically just improve your circulation and stimulate your energy in your cells. It gives you a chance. Nitric oxide is basically a vasodilator. When that nitric oxide is there, you have a chance to open up those blood vessels. With the laser, it's been shown that it takes a constricted muscle cell, activates the receptor, and relaxes the muscle, and it will help you cramp less. It will help you have much more energy. 3 different researchers, all independently, received the Nobel Prize in 1998 for discovering the exact same thing. They discovered nitric oxide is a signaling molecule in the cardiovascular system. So they proved it back in 1998. This is the year I graduated from chiropractic college. If you use vibration therapy consistently, it will have a 70% decreased chance of you having a fall. Now, I've had, I'm not going to talk to anyone specifically about this, but any one of these things can be partially helpful, but it takes a multi-treatment approach in order to really get to the bottom of something. Sometimes, I mean, if vibration therapy was just enough, you could get a little $30 handheld vibrator and just put it on your feet, 10 minutes a day, you'd be fine. If that was the only thing that you needed, is just a little more stimulation. Most cases that I see come into my classes aren't that simple. So how do we stimulate small fiber nerve growth? We use a nerve stimulator, and we basically stimulate it. We can use silver conductive socks, put those on, stimulate it, or we can put it in water, and then there's lots of nerves we can stimulate doing that. We also use a little probe where we actually touch that nerve directly, and we stimulate that. We can feed it through to the brains. We make that nerve fire so that the brain pays attention to that nerve. And once your brain and your brain stem pay attention to it, they will suppress the pain. They will suppress the numbness. They will suppress the tingling, and you will have improved balance. So we just help you integrate these things. We have lots of different approaches. I'm just showing you just a few of them. We have several. But we do have to decrease your inflammation. We do have to take you, once you're in inflammation, it's like you're on a teeter-totter. You're in the middle. You have to decide where your brain has to decide where it's going to go. Is it going to go this way, towards progressive destruction, autoimmune disease, neurologic, cancer, or are you going to head this way and actually heal any of these things, sunburns, allergies, broken bones? You can heal it all if you head this way, but then it has to resolve. If it stays inflamed for months and months and months, you end up causing more and more destruction. So we want to get you out of that. And I don't care if you're even here, all we want to do is, are you headed this way, or can we change it and head you back the other way? That's what I'm looking at. So you need to be able to decrease your inflammation. Most people, we can get them significantly down in 2 months. Significantly. Some more difficult cases, if you're under 35% function, it's going to take 3 or 4 months. So basically how we do it is we get a baseline. We can find out what your balance is like. We find out where your brain thinks you're at. Like, let's just do a little test. Close your eyes, everybody. Put your arms in front of you. And then put your pens down so you don't poke yourself in the face. So we're going to do a finger to nose test. Close your eyes and just point your index finger, and then just on one side slowly touch your nose. And then the other side, slowly touch your nose. With your eyes closed, no cheating. Good. So you know how well you did. Some of you missed your nose. And some of you had a massive tremor when you went towards your nose. So those all tell me signs. But we have to develop a specific score, a specific approach for you based on your own findings.
Question for you. Or do you want me to wait?
Hold tight for just, and let's get through these and then we'll ask the questions. If you do have some questions and you can write them down, but remember the question, don't forget. Here's some, can you guys have?
I'm not.
You got it?
Got it, good.
Anyone want to write these down? All right, we'll have time for questions in a minute, but I just want to make sure I get all of it. So, we have to address nutrition, we have to look at balance, we have to look at the small and the large fibers, and we have to look at blood flow. We cannot ignore any one of those things. If we do, the treatment that you choose is going to pretty much fail. Cerebellum, that's the part of the brain that controls your balance. You have to activate the cerebellum. Okay, so final thing. All right, we're getting close.